Right, welcome back to Good Day State Line. Today, we're hanging with Dan Frey, co-founder of FieldMed, and we just need to know your story. It's huge for what's going on right now. Tell me a little bit about yourself, Dan.
Well, a little bit about me. I was in the military when I got out. I actually moved to Rockford, lived there for a short time. That's where I went to my EMT school and met a few firefighters, decided that was the career I wanted. I spent the next 25 years as a firefighter paramedic. I'd come back to Texas, got a little homesick. So 25 years as a firefighter medic here in Texas. The last 7, I spent it as a community paramedic. I helped start a program here in 2013, seeing patients at home doing mobile integrated health, fell in love with it. And so with that, I found that there was no software to do the reporting. We had to track, report, trend the patients, and there was no software for it. So I started kind of doing just scratching it out on notebook paper how I wanted to see it. Met up with some guys that own one of the largest anesthesia reporting software companies in the country, and we formed FieldMed. I ended up getting an illness from the job and had to retire in July. And this is what I do full time now. So we do EMS software.
So FieldMed helps firefighters and paramedics to just get all the information in one place when they're not actually in the firehouse? What exactly is it doing?
There's software out there that's EMS software. So when an ambulance goes to a house and the paramedics interact with the patient, they report everything on certain software. Community paramedicine / mobile integrated health is a fairly new field in the last 8-9 years. So there was no software, and it's kind of a hybrid of home health, doctor's office, hospital, 911 software. There was no software for it. That takes me away from actually looking at the patient and getting hands-on and doing a good assessment on the patient and listening to them. So I wanted it to be a very simple software, and the company, the guys we have working for us, we've worked very hard in the last year to get that together, and it's patient-centric, very easy to use. And that's the big thing for the guys in the field, is how easy it is for them to use.
That does make a lot of sense because, when you go to a doctor's office, your regular doctor, they have all of your information there. They know your allergies. They know just your whole medical history. But it makes total sense that a paramedic would arrive somewhere and need to get that stuff. And it's hard. And sometimes it really matters how long it takes.
It does. It matters how long it takes. And a lot of what it does too is, you're in the doctor's office, they have their computer set up on the little stand, and they can sit at their table, their little chair and stuff. It cuts down on time. So your work day, if you saw 8, 9, 10 patients that day, you don't have to go back and do 8, 9, or 10 reports in the firehouse and spend 3 more hours. You can do other things. So it saves time. It helps, like I said, ease of use for the people in the field. And with the trending and tracking of the patients, it helps show if you're making the right care plans or the wrong care plans, and it can help you adjust what you're doing for that patient to get them on track and stay healthy.
That's so important. Like you said, it's not just one little piece of the job. It's having to spend so much time after the fact too. I love hearing about this and the story you went on. I have one more question for you, and that is, did you think when you started as a paramedic and as a firefighter that you would one day be somebody who helped create software?
I absolutely did not. Absolutely did not. And I've learned so much about software last year because I knew nothing about it. But I'm very proud of it, because I spent 25 years in the fire service, and the last 6.5, almost 7 as a community medic. And that was what I was most proud of, helping the people. And I can still do that. I can still do that here. And I have a great team we're working with. And, our software is incredible. And now that we have the telehealth out there, it's not just for medics in the field anymore.
Sure.
It's for doctors' offices, home health, everybody. And it's very cool. Now, I never thought I would be here, but it's very fun.
Yeah, well, we love telling your story. For anyone who wants more information on you or on the program, where can they go?
www.fieldmed.com.
All right, perfect. Thank you so much.
Thank you.
Coming up next, I'm so excited for you to meet Carrie from Habitat for Humanity. Her story is going to give you goosebumps. She's with us next on Good Day Stateline, but first, let's see how you've been having some good day moments enjoying it being outside.